everyone, my name is Jobeth Nieto and I am the CAO or the Chief Ancillary Officer here at the facility. I am very active in this new EHR that we will be implementing. I am responsible for supervising all activities in all the ancillary areas, including the laboratory, radiology, pharmacy, physical therapy, and other non-nursing departments, including respiratory. One of the things that I will be doing as a part of this implementation of the EHR is assigning appropriate staff from each of the above areas to fill the roles as super users. I will be actively involved in a leadership role in training all the ancillary staff and making sure that they receive all the training that they need. I also will be monitoring that all the patient results that come from each of the departments and any of the testing that's done is flowing appropriately from all ancillary departments to their appropriate destination and are accessible by all providers and staff that need those results within the hospital and the clinics. I also work very closely with our admin staff, including the CEO, the CNO, the CFO, and Chief of Medical Staff. Okay, so what I am going to be talking about is our planning phase. This phase tells you who, what, when, where, why, and how the EHR implementation and how it works. So one of the questions, and the very first one on the planning phase, is who? Who will the new electronic health record help? So it will be our physicians, our nurses, our physical therapist, our occupational therapist, our speech therapist, our HIM staff, other parts of our medical records staff, dietitians, our decision support analyst, mental health specialist, pharmacist, our pharmacy techs, our lab techs, radiology techs, radiologists, our data analyst, quality improvement analyst, utilization review coordinators, business office personnel, and social workers. And one that's not listed here, which of course they're not employees within the facility, but it is a person that the new HR will help, and that is the patient. So the next part on the planning phase, the word that's there is what. So what's the goal of the new EHR or the new electronic health record? Well, priority on our list is always improve patient care. We also want to reduce error rates, which also improves patient care. We want to improve accuracy and clarity of the medical record, reduce delays in healthcare, which can be monumental in a patient's prognosis, and also improving health information. The next on the planning phase is the when. When will this training take place? We will start training on December the 1st, and we have created calendars with dates and times for all staff members, and super users will have been assigned by that time, and they will have their own training date and time. Training will be provided for, like I said, super users, nursing staff, and this will include, on our nursing staff, there will be the day shift, the night shift, our PRN nurses, and our weekend staff. Also medical staff, which would be all of our physicians, our mid-levels, all of our providers will have their own training also. Ancillary staff, which would be again like our laboratory, our radiology, our physical therapist, billing staff, your health information staff, your clinic staff, and administrative staff as deemed necessary as to their part in the EHR. So next you see a calendar. This calendar, as you will see, will give dates for each and every one of our different departments and their training. And as you'll see, it runs pretty much consecutively 7 days a week. There are some Sundays that everybody has off, but you will see that first week we're going to be working with every department, and we basically want to discuss with each and every department our goals and what it is that we want to accomplish through this training and what we strive to do to be the best that we can be within this new EHR. So we want everybody to take advantage, and there will be time for everybody and their training. Like I said, the calendar, we start on December the 1st, and it does span through all of December, and then it spans through all of January. And as you can see, at the bottom of this slide, our go live is February the 1st. So the next word on our planning phase is the where. So where will this training be held? And another part of the where is where is the EHR being implemented? Well, it's facility wide. It is going to be through the hospital and through the clinics. And it is for all, like I said, all employees, and they will receive training per the calendar schedule that was in prior slides. And that training will be in our main conference room on the 3rd floor. And physicians may request a one-to-one training session. And I know I am singling out physicians, but this is not just for physicians. If there is another department, another set of employees, or anybody that feels like they need a little extra time, a little extra explanation to go through the different areas and screens within the EHR, that there will be time for that. So the next word on our planning phase is the why. So why? Why, well, we don't want to say waste time or waste money, but, you know, why would you do this if you have an EHR? So our goal, of course, and we've discussed this in prior slides, is we want to improve patient care. We want to be able to have a system that works with all the employees, all the providers, and there's an ease of how it goes through the whole medical record, how resulting occurs, how everybody can access the record and be able to manipulate through all the different areas. So number one, improve patient care. Be user-friendly. Be able to get in there, be able to do your job, and be able to make documentation, order entry so much easier. Physician, easy accessibility. We don't like frustration within our physician group. We want them to be able to get into that record and take care of our patients and be able to manipulate that system as best as possible. Also is we want to keep all the information secure. But another part of the why is we want interface capabilities. We want to be able to interface within different systems that produce resulting for testing on different things for the patients. We want to be able to have that information flow into our EHR and keep that medical record as complete as possible. Also, our CPOE, which is your computerized physician order entry, and also clinical decision support capabilities. So, now we're to the how. How to make that electronic health record implementation a success. Well, the first thing we want to remember here is, number one, we all want to work together and we want everybody to keep an open mind, and we've got to have steps. So, of course, the very first step is initiation. Initiation is the foundation. Just like in anything, you have to have a strong foundation, and you begin with that. Everything in place. So we initiate, we go through the planning phase, which is just what I've discussed with you, executing, monitoring, controlling, and closing. I'm hoping that I was able to explain to you the planning phase and how important it is in implementing an EHR, or electronic health record, and that you'll be able to put this to work in trying to get this EHR going. Thank you.